Hi, this is your Sussex County chiropractor, Dr. Wil Holdsworth from Pain Relief Chiropractic. I'm here with Joe today. Joe is from Been There, Dump That. It's a residential friendly dumpster service, all of northern New Jersey, and he also does martial arts. What he's in here today is he's having 10 out of 10 pain in his hip, but it's not all the time. It's only when he stands up. And go ahead and do that motion again. Go ahead and stand up and do that.
So what happens is when I'm getting my left hip on the outside of my left foot is when the pain just goes from 0 to 10 instantly once I get that shifting.
And it's a sharp pain, no numbness or tingling or weakness, just that one spot there. I usually talk about neck and back pain, but we do also do hips in here, so we're going to do some work on that. We're going to do some muscle work, and we're going to do some adjustments. You've been to a chiropractor before, so you kind of know what to expect.
Yep.
And he's watched some of our other videos too. So what we're going to do starting out is you're going to go on your stomach, Joe, face down. And yeah, like I was saying before we started filming, with martial arts, you know, especially when you're doing like kicking moves, any sort of sparring, you know, this is going to aggravate the hip. How many days a week are you doing martial arts?
2.
2. And it's karate, right?
Karate.
What belt are you?
Black belt?
Black belt. Oh, jeez. I better be careful. Do they put like stripes on them at that level or no?
No.
It's just black is black.
Black is black.
And how long have you been doing that?
8 years.
Wow, okay. So, have you had this hip issue while you were training at all before, or this is completely new?
While I was training, I could feel it. It seems to have gotten worse.
Okay. So how long have you been dealing with it?
At least a few years.
Okay. But only recently you've had a flare-up where it's really bothering you now?
Yeah, absolutely.
Okay. So with Joe right now, we're just loosening up the hamstrings. Hamstrings are definitely important whenever you're dealing with a hip issue. I'm also going to do like the whole leg, so I'm going to do the calf right now. I forgot to mention, Joe, if at any point this is too much pressure I'm applying, I'll go a little bit lighter and it'll be more tolerable. How you doing so far?
I'm good.
And Joe is a new patient. He hasn't been here before. You're our 3rd treatment video of the week, Joe.
Oh, great.
Yeah. No, we had, you're the 3rd new patient, new video we've done, which is kind of interesting. Very unique. Typically, people who come in here, it's a couple visits and then they're wanting to do a video with me, so thanks for doing one.
Oh, you're welcome.
So we're doing the glutes too. You know, same thing. Got to loosen up all the muscles in the leg here because the motion that's causing the hip issue is a compound movement. If you were paying really close attention when he did that motion with his leg, he's moving his ankle, his foot, his knee, and his hip to reproduce the pain. So we have to look at every joint that might be a factor in this. That way it's the most comprehensive approach. We get the most relief possible. And he can go on his way. And when are you doing karate again?
I'm not sure.
Taking a break right now because of this?
Yep.
How far off schedule are you? Like when, did you go this week?
No.
And did you go last week?
No.
Did you go the week before that?
Yep.
Okay, so you got a week and now almost coming up on 2, no karate. Alright, so now we're going to do the adjustments. These are easy, painless. You just breathe in and you breathe out. Good. And breathe in and out here. And here. And one more here. Good. Let's go on your side. Right side down, left side up. So everybody pops or cracks a little differently. Joe, you moved a lot, but they probably didn't even hear it. I don't know if you heard it. Yeah.
Yeah, I could hear it.
You could hear it. You could feel it. Bring your left knee up to your chest, back down to where it was, and repeat that. Go up and down. So it's like more of a munching with him, which is fine, but it's definitely, it's cool because I know a lot of people who watch these videos want to hear that satisfying release We didn't really get that with Joe. Maybe we'll get it with his neck. You want to do your neck today, or you want to leave it alone?
Yeah, no, that'd be great.
Okay. How you doing with this?
Good. I can feel it though.
Yeah, this is a big culprit of what's going on right now.
Yeah, you're definitely at the right spot.
Mm-hmm. You do any other forms of exercise?
Whew. A lot of housework.
A lot of housework. That definitely counts. And one more. Good. Stay on your side. I'm going to borrow this leg. This is his hip flexor. You're feeling it a little in the front, you said,
yep.
too. You a little ticklish?
A little.
Or the pressure, yeah.
Actually, a little both.
Yeah.
Yeah, I feel it.
You stretch before and after you train?
Always.
Good. And one more. Good. Rotate a little more away from me. Good. Bend this knee. Bring this leg back and then kick out forward. Back and forth there. This is his low back muscle, his QL. Loosening this one up here. Making sure we got the whole thing taken care of. 2 more. Good. On your back, face up. Bend this knee. Perfect. And you put your foot on the table and rotate toward me here. Perfect. Breathe in and breathe out. Good. Good. Go flat on your back. Loosen up the quads. Doing all right here?
Yep.
You gonna try to do karate this week if you can? Or next?
Not this week.
Yeah. So do you go to like competitions and stuff?
Yeah, I have.
Yeah?
Yep.
You got any coming up?
No.
No? Doing his adductors now. This is a spot that we work on with people with groin pain too. You know, the hip is where it is on the side of your like leg and the low back kind of and near the pelvis. But if you have groin pain, it could be your hip too. You know, it's all the same area essentially. And keep this relaxed. This is perfect. Good. That was what we needed. How'd that feel? All right?
Yeah, it felt good.
Bend this knee. Rotate here a little more. And let this leg come up. Good. Breathe in and breathe out. Good. Go flat on your back. Neck adjustments are loud for you. They're close to your ear. Mid back, low back, not so much. So it's the easiest way to describe it. No headaches.
No, not right now.
Let's check motion. You go that far that way. You go a little further that way. So we're going to adjust into the restriction to improve the motion. Good. Go over here. Relax this. Good. And we'll do one little one down here. Good. Now we'll check motion. And you're even now. Good. Good. Okay, Joe, let's come up. We're going to do your special test. You're going to stand up. You're going to do that move where you reproduce the pain before. Be as honest as you can. Let me know if it's the same, better, or worse.
I'm not really feeling it right now.
Not feeling it. What about with your hand off of it?
No.
Not feeling it at all?
No, I'm not, actually.
Good? All right.
Yeah. Well, last night it was It was tender.
Yeah, good.
Yeah, it's not there.
Well, we got the right motion out of it, you know, so getting in here early is good because it will release easier. If you've been dealing with this for years, it's a little harder, but that release that I got with your leg, that's what we're looking for.
Yeah, that was great.
That's a big, big part of it. Cool. Any questions?
No.
All right.
That was good.
Great.
Hey, I appreciate it.
Yeah, thanks for doing a video with me, Joe. This is Joe for Been There, Dump That, the residential-friendly North Jersey dumpster company. So if you need anything from him, he's your man. So thanks for watching, everyone. I'm Dr. Wil Holdsworth from Pain Relief Chiropractic.